Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi, a platform for the doctors by the doctors. Here we discuss journeys and experiences of successful medical practitioners. If you have an interesting story and you are a doctor, then connect with us. We would like to feature you as well. Today we have Dr. Gaurav Rathi, Major Dr. Gaurav Rathi with us, who has been with Army since the last 5 years and has done amazingly well. He, post his graduation in dental surgery, joined Army instantly, and it's really nice to know somebody who is so motivated to be in the armed forces and is doing so well in this. Welcome, doctor. It's so nice to have you on the platform. Everybody's really wants to listen to your insights in Army. Welcome.
Thank you, Aishi. Thank you, Aishi. And hello, guys. How are you all doing? I am Major Dr. Gaurav. I am practicing in Army since 5 years, and we'll begin shortly with our all questions and queries.
Yes. So, yes. So, as we already mentioned that you have, you joined Army post your dental surgery, what was your motivation? Because mostly people think to do their post graduation and, look forward to what was your motivation to be in the Army post your graduation? Why did you do that?
See, I always wanted to be in the Army since my school. But unfortunately, I met with an accident in my 12th class. So I couldn't give the NDA exam. So then I joined dental surgery. Then I came to know about AD Corps. Then I was motivated since beginning. So it wasn't very difficult for me to choose a career besides Army. So I straight away went for the Army.
Okay.
I was motivated from beginning. There was no doubt in my mind.
That's so nice to know the youth being so motivated, and because you were so motivated, so you could join in and clear through. I'm sure that was the reason. So let's start from the start. When you plan to join the Army post your graduation, how does it start? How do you start with your preparations and everything? Please starting.
In our time, there was this interview was based upon the final percentage of final year marks. Okay. So straight away, when I finished my internship, I filled the form of Army Dental Corps. They called me up for the interview.
Yes.
Then I prepared for the interview. I cleared it through, made it through the medicals, and got commission. So it was very clear from the beginning in my mind.
Okay.
So nowadays, it is slightly different procedure to enroll in the Army Dental Corps.
Yes.
Previously, it was based upon the final percentage of the final year marks.
Okay.
Now, for the interview, for the eligibility of the interview, you should clear NEET.
Okay.
So there is an option in the NEET form whether you want to
join SSC or not.
Join SSC, or whether you want to willing to get interviewed by AD Corps persons. Now, if you tick that option, now on the basis of your NEET rank, your relative AD Corps interview rank is prepared. Suppose the person who got 130th rank in the NEET exam, but he was the first person who ticked that option of SSC. So he is now ranked first among those who are called upon for the interview. So usually per vacancy, 15 candidates are called upon for the interview.
Okay.
And interview lasts in a span of 7 days, 5 or 6 or 7 days, depending upon the number of the candidates.
Okay. And approximately how much is the vacancy, per SSC?
Yeah, it varies over the years, but usually on an average, it counts for the 30 to 35.
Okay.
On an average, 30 to 32 on an average.
Okay, so you're telling me, per seat, at least 15 people are 15. Called.
Yes.
Okay. Cool. So that's really nice. So, and if, is there any now, because previously it was percentage of the final year, is that also still count the percentage?
No, you have to get at least 55% of the marks, and I'm sure most of those will get 55% of marks, because in mostly colleges 50% is the passing marks. And one more criteria is important: you should clear your final year in single attempt.
Okay, there needs to be no supplies in that.
There need no supplies, and you should clear your internship
in one go,
very much delay.
Okay.
Without very much delay. Okay, 1, 2, 3 months delay can happen, but without very much delay, you should clear your internship.
Okay. So these are the 2-3 points, very important points actually, Dr. Gaurav. You know that post NEET, you know, the number of seats that are available per seat, there are 15 candidates being called for the interview, firstly. Secondly, you need to have at least 55% in your final year examinations and have to clear your final year in one go. That's very important.
That is the important thing.
Yes, that's really nice and very insightful actually. So when it comes to fine weekly, I have, you know, if I'm giving the examination, I cleared the
one more important thing, whether you are BDS or MDS, you have to appear for the NEET.
Okay. And is it that MDS people are being you know, preferred over BDS? Does that happen?
Previously it was done in several years. Before. But now NEET marks are the criteria for the interview.
No. Okay, that's also very nice. So, you know, even if, you know, you don't plan to do MDS, don't think that you are lagging behind, because now, because of the NEET, everybody is on the same platform. You know, you just need to work hard for your NEET examinations and you can make it through. So now, if, you know, if for example, if I'm giving the NEET, I cleared the examination, I am being called for the interview, how does it go through then? How should I, you know, a bit preparation for the interview, what should I study, and, you know, how should I dress up during the on the interview day, how should I perform in the place, what is my, you know, behavioral? Okay,
as you had cleared your NEET already, so you must have had a threshold knowledge about the all 4 years or about the academic syllabus. Now besides that, for the appearance of the interview, you should dress formally, absolutely formally. No jeans, no casuals, t-shirts, or some fancy clothes are allowed. They should not be there.
Okay.
Then, besides your academic syllabus, your academic questions,
and how should
ask about the general awareness, and there is a psychological evaluation is also there.
Yes. No, questions is definitely one part. You know, Dr. Gaurav, first let's concentrate on how should I act when I'm there in the R&R, the Army R&R for the interview. You know, is there a way of conduct that I need to take care of? You know, how?
Yes, you should be very sober, very formal. Just go in there, submit your documents whenever you are called upon. Then sit properly in a designated place. They will call you one by one, and be vigilant, be observant. What is going through? What's happening? Okay. So there are many posters in the in alley. Okay, you must observe them. So suppose because observation is a very important criteria for a dental officer or for any clinician. Okay. So they will ask you about the observation capabilities. They will ask you about what did you observe in LA? What are the posters about? Okay. They usually are 10 to 12 officers are there for the interview. IAS is also there. Representative of cantonment board is also there. So their main job is to do psychological analysis and overall personality analysis.
Personality evaluation. So are you being also judged? You know, are there people keeping an eye on you when you are there waiting for the interview?
Yes, we are being judged continuously throughout the day. Whenever we are either whether we are appearing for the interview
enter the
or
arena,
whether we are sitting there. Their representatives are roaming all around us. No,
Okay.
there is only job is there to observe us continuously,
Okay.
and they will keep on feeding them.
Okay. So that's really nice. You need to be very vigilant there. That's something that people get casual with, but you should not, especially when you are going for an army interview. So now let's get into the interview part. You already have told that there are multiple people there taking an interview. How many people approximately do you are there?
Around 10 to 12 people are there.
Okay.
There are specialists concerning of different specialties.
Okay.
Mainly 4 core specialties are there.
Okay.
Endo, perio, oral surgery, and prostho.
Okay.
Okay. The most of the academic aspect of the question or interview they will cover.
Okay.
Then there is a deputy director or ADG sitting in front of you. He will analyze your body posture, your confidence, your way of talking, way of speaking, whether you are confident or jittery in your questions, in your answers. Okay. Then they might ask you about general awareness thing. What did happen today? Now, what is the latest news in media? Okay, you should be aware of that, because as I said, 15 candidates per seat, usually 30 seats are there. So they will call around 450 candidates in a span of 7 to 8 days.
Yes.
Okay. An interview begins from 8 a.m. to 4 p.m. So there is ample of time for each and every candidate. Okay. They will grill you. They will interview for at least 20 to 25 minutes. At least minimum is 15 minutes. The 15 minute is sufficient enough to get through you.
Yes, definitely. You can, you can easily do that. So cool. So after that, that's fine. So how are the questions? You already told that there are 4 major specialities. Then there are current affairs also that you mentioned. And then there is personality also. How you have already mentioned that the person should be confident. Is there any other way that you want to, emphasize on? Is there anything else apart from this that you want to emphasize in for interviews?
Yeah. You should be leading your interview rather than let them dictate your interview.
Okay.
For suppose if they ask you about your hobbies and your areas of interest,
okay,
then you must told them what you know the best. Suppose you will tell them my favorite sport is cricket. So they might ask you a match or some statistics from the 1970s or 1980s.
Okay, they go
okay. We being 90s kids, we don't know about what has happened in 70s or a famous cricketer from the 80s or early 70s.
Yes.
So you must tell what you know the best.
Okay.
I'll give my example. I told them my hobby and my favorite sport is wrestling.
Okay.
So I knew from the beginning that if I told them wrestling is my favorite sport, so there is only 2 or 3 questions are there. Suppose who is the first medalist winner? Commonwealth Games had just happened. Who are the medalists and who is the greatest Olympic medalist for India in individual games? So I knew all those questions.
So you need
hardly 3 or 4. So I was asked who was the first Olympic medalist from India. He was a wrestler. I knew that. Okay. So you should lead the interview rather than let them dictate.
Okay, that's very nice. It's a big insight, I believe. So after that, there are interview thing is definitely done. Post that, there is medical and physical examinations. If you ask me, how things go through that?
No, you should be average.
Physique.
Extreme physical fitness is not required.
Okay.
Okay, but you should be free from any visible disease, diabetes, any congenital heart anomaly, any visible deformities.
Okay.
You should be averagely fit.
Okay.
Not too much overweight, not very underweight.
Okay. And what
Just
about
average
height?
will do. 6x6 with specs.
Okay,
Will
6 by
do.
6 with specs. Okay.
Nothing to concern about it.
Okay. And for height, is it 5 feet? You know, there was somebody who
Yeah,
asked.
minimum criteria is there. Minimum criteria is there.
Okay. Okay.
There is no bar upon heights.
Okay.
4 feet 8 inches, 4 feet 10 inches for girls, and I think 5 feet 2 inches for the boys. And mostly we cross that bar.
Okay. Okay, that's really, you know, insightful to know. Also, if somebody who is a repeat, who is attending the interview, you know, if somebody is giving the interview for the second time or the third time, is there anything, you know, is it a positive part or a negative part? How does it is taken?
Mostly it is positive. Mostly it is positive because if you are appearing for the second time or for the third time, no, the one thing is for sure that you are motivated.
Yes.
So it will play a big role in your selection.
Yes. Yes.
Because you will get some extra marks or some extra points in the category of motivation.
Yes.
And that is a definitely advantage.
And especially now when it is neat that you have to clear every time, it is definitely a lot of motivation for you to do that. And is there any age that we should, you know, that only till this age we can clear neat and come for interview?
Till the age of 44, you can appear for the interview.
Okay. Okay.
Till the age of 44.
Okay, so it's decent age. Good. That's really nice to know.
And that is the highest among the army.
Okay.
No, the second most raised age is in the JAG for the lawyers.
Okay. Okay.
And there is no bar for the married or unmarried peoples.
Okay, so there's no problem.
Married peoples can also appear.
Okay. Okay, that's nice. So they are not judged for being married. Okay. So now, you know, for example, if we have cleared the interview, you know, what is how things go on the next step? You know, is it the training happens? How things
go once
forward?
you are commissioned, then you are posted mostly in your nearby hometown.
Okay. Okay.
Then if you are lucky, you get a letter from the DG branch that you have been selected for the MOBC, Medical Officers Basic Course.
Basic course. Okay.
Which occurs in the Lucknow.
Okay.
For the 9 weeks.
Okay.
In my time, it was 9 weeks. Then it was reduced to 7 weeks. And now it is again 8 or 9 weeks. I'm not sure.
Okay.
But it is around 9 weeks.
Okay.
63 days. Okay. So you might have to wait for 3 months or 6 months for the
MOBC
training purpose. But you will be trained in Lucknow Medical Officers Basic Course along with the Army Medical Corps persons.
Okay.
Okay. Usually dental officers are 8 to 10 in a single course. And there are 110 people in a single course on an average. Okay.
And
it occurs in the Lucknow. And there you will be taught basic military aspect of Indian Army.
Okay. Okay.
Perfect. Beginning from the morning drills, morning PT, running, keeping yourself fit, motivated. Then in the classroom, you will be taught about army, structure of the army. No, forget about your professional
life, professional course
part. There will be no professional part in medical officers basic course. Only army structure, military part, what you are supposed to do in different establishments. Okay. Because as an individual, I can be posted in a independent section or in a big hospital. So the structure of Army Medical Corps or Dental Corps and all supporting arms are taught. So
okay,
mostly you are independent on your own in a section. So you must know how to purchase things. You must know how to complete paperwork. No, it is a very, very big aspect in the army. Keep your all documents very neat, very tidy, very up to the date. There is no chance of corruption there.
Obviously, that's the best part of army, I believe. So that's really nice. Actually, they basically train you for the army to get you into the army.
Yes.
So after that, how with dental corps, how are the postings? Do you get posted on the borders as well? Are they difficult?
After the medical officers basic core MOBC training, for the dental professionals, there is a separate course.
Okay.
Of 7 weeks.
Okay.
That is the command phase that occurs in the Lucknow.
Okay.
So there you will be taught about specifically your professional part and dental part.
Okay. Okay.
There you will be taught about how military dentistry works. Military dentistry is something very different from the normal practice. Okay.
Okay.
Patient compliance can be very good at times. Patient will come, if you have told them come at 9 a.m. they will be there at 9 a.m. sharp. Or at times, if you are posted in some remote area, patient is already on move. So you have to judge on the basis of location, on the basis of patient compliance, what treatment you must provide. So there you will be taught. Suppose patient is going for the patrolling or for a long time in forward area, forward post. So you cannot start an RCT.
Yes.
Okay.
Yes.
You cannot just do the indirect pulp capping. Patient might feel pain there. So it's better to extract those teeth. Okay. So at times, dentistry is very conservative in big centers and very aggressive treatment in forward areas. Okay. You have to alleviate the pain. Major goal of the treatment in forward area is to alleviate the pain.
Okay. That's really nice. That's nice to know. So when it comes to so the dentists are not posted on the borders that way. We are posted only on the district centers. Is it the case, or you are posted on borders as well?
No, dentists can be posted in forward areas. So there is a structure called field hospital. Okay. Field hospital has different sections. No, I have been posted in very forward area, very remote area in Arunachal Pradesh. Okay. It won't be bang on border, but you should expect that your posting will come in active area. Okay. Wherever the army is, wherever the I think 4,000 or 5,000 troops are there, invariably there will be a dental center. Invariably. Because in our ratio, in our criteria, per 4,000 troops, a single dental officer is required. Okay. So whenever the 4,000 troop strength is posted, then wherever it is posted, a dental center must be there.
Okay. So, good, postings is something that we understood about. Now, what about permanent commission? If somebody has got into short service commission and loves the army and wants to extend it to the permanent commission, how can he or she do?
After 2 years, he will be eligible for the interview for the permanent commission.
Okay.
He will have to just fill the form that I am willing to undergo for the interview for the PC. For the BDS, cutoff age is 30.
Okay.
For the postgraduate, cutoff age is 35.
Okay.
On the year of the interview.
Okay. Fine.
And in the first tenure, first extension, 3 chances are given. In the second extension, 1 chance is given. Usually,
and
not more than that.
How long is the short service extension?
The first for the short service commission, first extension is 5 years. That is compulsory, mandatory. After 1 year, before 1 year, you can leave. But after, if you have
1 year of
done the service for the 1 year, then you have to do the job for the next 4 more years. Okay. Then if you are willing, you can fill the form that I am willing to extend my service, fill it, and you will be granted 5 more years for the extension. Then 4 more years of extension. In total 14 years.
Okay.
Okay. It is different from the AMC that you must be willing to extend your service. In AMC, willingness is not asked. Unwillingness for release is asked.
Acha.
Okay. If you want to get released, you
Then-
should be unwilling.
Okay.
Okay. If you do not fill any form, your service will be automatically extended.
Okay. Okay. With ADC, you have to fill a form to extend your.
In ADC, willingness is required.
Okay. Okay. That's nice to know the difference as well. So, this is good, and you have already mentioned. Okay. So for PG, how should we do things? How can we do PG, ADC?
We again have to give NEET exam.
For PG as well.
For PG as well.
Achha.
Okay. After one has got permanent commission, he is eligible for the appearance of the NEET exam through the quota of army. Okay.
Okay.
Now, when it happens after 4 years. Okay. After 4 years of service and you are permanent, you are eligible to appear for the PG exam.
Okay.
And the rank will be made among only those who are in the army. So only relative rank is then made. And there are 4 specialties: perio, ortho, prostho, and oral surgery.
Okay.
And ADC is providing PG in only these 4 specialties.
Okay. Okay.
2 places are there: Delhi RNR and AFMC Pune.
Acha. Okay. Only 2 places.
32 seats are there, I think.
Acha. Okay. Okay. So, we cannot do PG in SSC. Only in permanent commission.
We can do PG in SSC, but we have to take NOC from the ADC. Achha. Not through the army quota.
Okay, not through the
army. Usually it is prioritized. Priority 1 is for the permanent commission
people,
permanent commission officers. Second priority is the CAPF or ITBP dentists. Third is foreign candidates, foreign and civil. Fourth is SSC candidates. Okay. So usually priority 1 is filled. Achha. They don't even go to priority 2 because seats are very limited. Seats are only 20 around.
Yes. No, that's nice. That's a very insightful thing. So when we have discussed all throughout, how to enter, how to do everything, how has your experience been in army till now?
As I said, I was always motivated to join army. So I dreamt of it. So my lifestyle has never been so much better before. When I joined army, I was very happy. I fulfilled my dream. For me, it is very, very satisfying, very good, very professionally positive, physically positive, mentally positive, positive in almost every aspect. I am always motivated to perform at my best. Okay.
Nice.
So it was very good for me. Since 5 years, it is very good for me.
And what are the challenges that you have faced in army? Is there any challenges?
Challenges are, you first of all, you must be very organized. Okay. You will face difficulties if you are unorganized.
Okay.
And you have to have a very good analytical mind. As I said, in forward area, you may not get very idealistic environment for working. So you have to prioritize treatment. You have to prioritize the candidates for the selection of the treatment. What treatment you are doing, you must prioritize it according to the situation. You must give the treatment. Apart from your professional, you must know the administrative work. Okay. Invariably, a dental officer will be required to run an individual independent dental section. Okay. So for that dental section, you are whole and soul. For a dental section, you are its owner. Okay. But your ownership is not yours. Okay, it is of the army. So you must be very, very honest, very, very transparent, and very, very up to the mark in terms of maintaining the documents. So how many things you have purchased, how many things you have expand. Okay, then you have to manage your man. Okay, usually we are posted with a dental operating room assistant and a nursing assistant.
Okay.
Usually in an individual dental section. As you grow in the service, you must know how to manage their leaves, how to manage their documents, all paperworks. You should know that.
Okay.
It is a very important part.
That's really that's nice to know. Otherwise, you don't understand that managing the administrative part is also a very big thing. So, Dr. Gaurav, we have multiple questions people are asking. Firstly, is there things like knock knees, flat foot? Are they considered?
The flat foot is not a big deal.
Okay.
Flat foot is invariably considered if it is along with other deformities. If it is very, very visible, very debilitating, it can be considered. But usually it can be overlooked. In most of the cases, it is overlooked.
Okay.
Knock knees are not an issue.
Okay. And
for a smaller extent, knock knees are not an issue.
Okay. And when it comes to color vision?
The color blindness should not be very prominent. Okay.
Okay.
Usually they go through the ECRR chart for the first 6 to 7 slides only.
Okay. So there is, somebody who's asking that I have been learning taekwondo, but do not have any belt. Should I mention that in my interview and all?
Yeah, you should mention in your hobbies. Okay. That will have a positive impact.
Okay. I believe maximum of the other things we have covered. That's it. It's so insightful to know all of the things from you, Dr. Gaurav.
Okay.
Yes.
Just during the interview, be very confident. Okay. There is no place for the jittery persons. If your hands are cold and clammy, you are setting, they will observe it.
Okay.
And they will be very hesitant to pick you up because he's very very nervous. How can he do? Okay. So slight bit of nervous is necessary for you to perform better.
But
okay. You should be a little nervous so that you are vigilant, you are excited, you are very careful, and you are very observant.
Okay.
Only that much amount of nervousness is required.
Okay.
And
any of your, some high, leaving the interview on the high point for the dentists who want to join the army?
So the aspiring dentist who wants to join the army, only one thing, be very organized and be very confident in your life. Okay. Whatever you do, whatever you perform, be it in your surgeries, in your clinical surgeries, or be in your college and school viva, or be it in your clinical practice, or be it in your interview, be very confident and organized. Okay. Once again, I will say you should lead your interview rather than let them dictate.
Okay. That's so nice to know, everything about Army Dental Corps and the insights about. Thank you, thank you so much, Gaurav. I have Dr. Gaurav, actually, I have also learned so much from you and known so many things indeed that I didn't know about. So thank you so much, Dr. Gaurav. I'm sure, all of our viewers are, really happy to hear you and to know all the insights about the Army Dental Corps. Do
Thank
share
you,
this. Yes.
The pleasure is mine.
Yes, definitely. We really like the interview.
I guess it's now 13 years since we have known each other.
Yes.
13 years.
Yes. So, I must mention he has been with me in my bachelor's. So he's a good friend of mine as well. So after, when I wanted to cover Army Dental Corps, he was the first person who came to my mind to cover, and he has done it so well. So, I'm sure it has been so insightful for all of our viewers. Please share it with your friends and your colleagues who want to join the army, who are looking forward to do so. I'm sure it will be really helpful and insightful for them, as well as if you are a doctor and have something interesting to share among the doctor community, do ping us and we will like to cover your story if it's really helpful to the fellow doctors. And do make sure to look forward for our next interview coming up on next Sunday at 11 a.m. with a very interesting topic. So stay tuned on our page for all the interesting interviews to keep you motivated and helping you to be a better doctor and a better person. Thank you so much, Dr. Gaurav. And
thank you, Dr. Ayushi.
Yeah, thank you everyone for being there. Thank you. Bye-bye.
All the best.
Yeah, thank you. Bye.